I'll hand over now to Professor Edelson, who's going to walk us through the very impressive project that is being undertaken in Mexico. Jaime.
Hi, good morning, everybody. I'm broadcasting live from Mexico City. It's very early in the morning, and I hope you'll bear with me. Thank you, Raman, for the invitation. I think that we have a very interesting case to share with you this morning about mandatory daily brushing. We were able to present a law in Mexico, and I will let you know how this story went. Next. As you may know, the concept disruptive innovation, it's something that comes into a market and creates, by disrupting an existing market and value network, displacing established market leaders and alliances. And this is a concept that was introduced by Clayton Christensen from Harvard School of Medicine. And in short words, next, it creates the when we apply it to dentistry, we can say that the dental caries prevalence is very high, and it's rising in most countries, especially developing countries. The access to oral care is very limited, especially developing countries. Sugar daily intake is rising worldwide, and school is a great place to acquire and solidify good habits at early ages, plus an excellent opportunity for a daily experience. Next. Some of the projects that are being done by the Mexican Dental Association Foundation, which I'm very proud to chair for the past 9 years, includes something for preschoolers. Then it was the first real pilot with 30,000 kids on daily brushing. Then we started to do daily brushing with fluoride varnish. And now we're also interfering with in public health with an oral cancer awareness and early detection program. Next. You see, we have a vision at the foundation, which is the basis of this. Any reactive program in dentistry will fail if it doesn't include a very strong educational preventive program. And all of a sudden, one of these big millionaires of the world would come to Mexico and give us all the money to clear and get all the children fill their cavities in their mouths. We are talking about a lot of children in Mexico. It wouldn't be good, because by the time we finish sealing all those cavities, we will have to start again, because dentistry has abandoned in many ways the importance of a very strong educational preventive program. So that's why this was the basis for our project. Next. You see, when we say Mexican children, who are they? Well, in kindergarten and elementary school, we have 28 million kids. 55% are below the poverty line, 7% in extreme poverty, 98% attend school, 94.2% of the kids are vaccinated, 40% live with one parent, 7% are malnourished, and 70% overweight. Mexico has a #1 place in child obesity worldwide in elementary school years, 90% of dental caries prevalences in ages 6 to 12, and very limited access to oral care for the underserved. Next. And as you can remember, the World Federation of Public Health Associations came up with the basic right of children for oral health in 2013. And then 2 years later, we invited Professor Betty to Mexico City, and we tried to take this out of the drawer, out of a file, and created a reality where the government, the community, and the dentists, the parents, the children, everybody would try to make this oral health basic right for children a reality. Next. That's how we started to introduce all these people. Now, it all started by a preschool oral health program that started with the Mexican Dental Association in 2008. Over 120,000 kids were treated in 11 years. That program still goes on. But we found that we can include many good habits: washing hands, healthy non-cariogenic lunch, daily brushing, and fluoride varnish applications twice a year. It lasts a full year, but it includes dental volunteers, teachers, and parents for this to work. But it included dentists. So it was a very beautiful program. It still exists, but it's based, if we don't have the volunteers, dentists, then the program doesn't work. Next. As you can see, a lot of volunteer members of the Mexican Dental Association were eager to participate in this program, but it was only for the preschool children. Next. Then we migrated to school-based daily brushing at elementary school, where we were able to do a pilot test with 30,000 kids and it lasted 4 years, 30,000 kids every year. And we tried to introduce what we've learned from the preschool. Wash your hands, eat a healthy food, and brush your teeth. Next. Next. Every child was given a toothbrush, a toothpaste, a cap, so that the toothbrushes will not contaminate with one another. And these things stay in the classroom. They don't go back home. In Mexico, we have a problem if you only give away the toothpaste and the toothbrush for the children to take home, then they wouldn't bring it back to school. Next. The brushing was done after the meal they had in school. Some had breakfast, some had lunch, some had a meal, some had an afternoon snack. So the brushing came after that. At the same time, we started a program with the Mexico City Family Services program. We started with 5,000 kids that will get fluoride varnish once in each semester, twice a year. Then that number grew to 10,000. And this year we were very happy that the new chair for the family services in Mexico City decided to go for 180,000 kids just in Mexico City that they have fluoride varnish twice a year. And we provide them with toothpaste and toothbrush so we can have both. And as you can see, it's a party where parents come in and we have the fluoride varnish application in front of everybody. There is a clown or an entertainer. And then this happens twice a year in one of their centers. Next. Now, the lessons we got from the first pilot of the 30,000 kids for 4 years is that oral health education must be considered in the school curricula. It used to be when I was a child, and then it disappeared. Kindergarten and elementary school are great to embed good habits in young children. And good habits are a gift for life. We know that most of these children, when they brush and they start at age 3, by the time they finish elementary school, they're going to have 9 years of daily brushing. And some of them, most of them, that's the goal, fluoride varnish twice a year. Next. And then teachers can become strategic elements in oral care. We always thought about the dentist, the dental nurse, the dental hygienist, but this time we're exploring it outside of the premises of the dentist, both in the dental school or in their practices or in the public infirmaries. Next. Now, the lesson from the first pilot of fluoride varnish plus daily brushing, that was interesting. Next. We saw that the government can spend money on oral health that does not come from health ministers. This was a very big discovery because we are used to think that the only one who can come up with the funds, it's the Minister of Health, and they're always treating something else. And then dentistry comes in many, many countries at the very last end of the budget. But here we were using money from family services, from the Minister of Education, and we had to go to the source of the money, which is normally not the minister, but the Congress, both in either the city or in the whole country. Next. Now, in preschool programs, remember, we were dentist-based. We need volunteers. In school-based daily brushing, it's teachers-based, and teachers go to school anyway. Next. Mexico's disruptive opportunity to improve children's oral health. Next. But the next challenge was how to move from 30,000 kids that were brushing every day in Mexico City in 100 schools to 28 million kids in the whole country. Next. Now, the programs, I had my programs finish when the flow of products ends. We have all done in parts of our life a program where we get a toothbrush or toothpaste from a company. But when there are no more products, this is the end of the program. The programs are suggested to constant supervision and positive measurements, or they get discontinued. But a law is not subjected to evaluation, at least not in Mexico. So bingo. Then we had a good opportunity to do something really different. Next. We're almost done. So we started to have different kind of forums, but this time we went to the source of the money, which is the Congress. In this case, the Congress in Mexico City. Next. And finally, we were able to produce a law that said that at the beginning of every school year, the Mexico City government has to buy every child that is enrolled in preschool or elementary school one toothpaste, one toothbrush for home, and one toothpaste and one toothbrush that stays in the classroom for the duration of the year. This is the Mexico City mayor, the day he was signing the law. It was a very big thing in Mexico. It was the first city, as far as I know, that will allocate money or a budget every year so every child can get a toothpaste and a toothbrush at the beginning of the school year. And we're talking about 1.25 million kids. The toothpaste and toothbrush were in these packs with no political message whatsoever. Next. It was a product by Colgate because Colgate in New York was very kind, and they give the first lot for 1.25 million kids on top of what the government bought. Remember, the important thing was not to give them the toothpaste and the toothbrush. The very important step was to get the government to put the money resources to give it, and then to hire 10,000 volunteers that were delivering each pack for each day, and it took them about 2 months. And we needed a platform so the teachers would get trained. So we got an educational platform which has information for teachers, for children, and for their parents. Next. It has different even games so the children would get engaged and the teachers. Now, it took 5 years. You know, it's not that one day I woke up in the morning and I come up with a law. The first workshop was in May of 2012, and the law was signed into law on April 19, 2017 by the head of Mexico City. And then this is when we got another lesson. We have to go to the source of the money, which in this case, it's the Congress. So we're in these pictures, we are in the Mexico, now the country's Congress, trying to get this at the federal level. Next. Now, I can tell you very proudly that we had another state now in Mexico, the state of Veracruz, who already passed the law. In this case, they're not going to give the toothpaste and the toothbrush, but they agree that the toothbrushing has to be mandatory in the classrooms of all the state of Veracruz. And this goes now to 1,200,000 kids that now add to what's been done in Mexico City. Excuse me. Plus what we're doing with family services now all over the country. So altogether, it's over 3 million kids who are brushing every day starting this school year. We go by school year, not by calendar year. Next. We're almost done. Now, the law exists in Mexico City with 1.3 million kids, in Veracruz with 1.1 million kids. And we already presented the law, and it's in different parts of the process of vetting and then voting in the states of Baja California, Jalisco, Guanajuato, Nuevo León, Campeche, Yucatan, the state of Mexico, and the Senate at the federal level. But the federal level goes very slow. So that's why we started to do each individual state. Mexico has 32 states. Altogether, it's going to be 28 million kids, ages 3 to 12. Next. So it was a very fast, drawn view of the project. But I hope, and I'll be around if you want to ask me any questions or write me directly. You can find me in either Instagram or Twitter with jedelson55, or you can write me an email at jedelson@mac.com. Thank you very much.
Jaime, thank you very much for that. It's very impressive. The numbers are staggering. But one of the things that you've highlighted is that toothbrushing is a learned habit. Parents teach it to their children, but actually it is a learned habit. And one of the best places to enforce it is schools. And what's impressive about your program is that you built it into the school curriculum so that the teachers are teaching dental health education messages, and they are actually part of the learning that a child expects to receive when they're at school. I just wondered how you found the teachers' responses to this program.
Well, the smaller the children, the best the response of the teachers. And it's been a process. I mean, we started in the school year 17-18, but every year we get better. Every year more teachers are involved. We have a platform where they can get their training and they get back like a diploma that they pass the daily brushing. Now, we dentists try to make the teachers dentists. That's wrong. The teachers only show the basis for the children, and there is a time for the brushing, which is not considered a loss of time. That was also very hard at the beginning. But as the teachers understood that we were there to really help them, and that they know washing hands is very important before you eat or after you go to the bathroom. So brushing is very important after the meal. Now, this is not the best time to do it, but remember, we're more than teaching the children to brush. We are creating the good habit of eating. And before you eat, you wash your hands. After you eat, you brush your teeth. And the best thing is that in one of the epidemiological studies that were done, and by questioning the parents, they told us that now the children are going after them at night. Mama, are you going to brush your teeth? Papa, are you going to brush your teeth? After they have a meal at home, which used to be the other way around. You know, the parents would have to go after the children. So that means that we're doing something good. And the teachers, to finish your question, it was our concern, but teachers who have a heart for teaching know the importance of these things.
Jaime, thank you very much. I think what you've highlighted, which is so often forget, is that we don't want to keep dental health programs like toothbrushing separate. It's not something that just comes to a school, is undertaken, and they leave. You've integrated it into the school curriculum, the teaching, and it's part of the daily life of a child in school.